Good evening. I'm Dr. Erica Taylor, the host of Dr. Taylor's Table Talk, hosted by the Chicago Department of Public Health. And I want to say hello to new guests as well as welcome back individuals who tuned in to see us on last week. Today we have a very special guest, Dr. Maya Green, who is the Chief Clinical Officer of Howard Brown Health in Inglewood.
Yes. Dr. Taylor, thank you for having me. For those of you who I've never met, I am a South Side Chicago person. I'm a Black woman from the South Side of Chicago, and caring for communities of color is my passion. Right now, that looks like I'm the Chief Medical Officer for Howard Brown Health, which is a citywide agency providing care in the community. We're a federally qualified health center, which allows us to provide more care to communities that are traditionally overlooked and underserved, which CDPH and so many other organizations are doing, and I'm so excited to be here. Thank you.
Thank you for being here with us. Can you talk a little bit more about the passion that drew you to work in this community as far as like committing yourself to the FQHC population?
So a lot of things, right? We're all a makeup of all of our experiences. When you say the passion, the first thing that comes to mind is seeing my mother cry when my Uncle Bebop is what we called him. His name was Robert Bolden, right? And we were his chosen family. I remember in the 1980s, I was a teenager. Even though I looked like I was a baby in 1980, I was a teenager. But I remember seeing my mom come home crying because Uncle Bebop was dying of what was called AIDS-related pneumonia. Now we know what it is. We have further terms, but at that time in 1981, just remember, people are like, what is this, right? And at that time, the stigma associated with HIV put him in a predicament where his family wasn't, his biological family wasn't visiting him, and all kinds of things associated with otherness, which is what so many of our Black community experience right now. And otherness usually puts on a reason why you deserved what's happening to you. So you're dying of HIV, you did something to deserve that. You are not like me, and it doesn't come to my door, and that's on you, and you have to find your way and navigate through that, right? So I remember the tears my mom had, and HIV was such this mystery for me that I ended up studying it more, even as a teenager, trying to find out what separates families like that, what separates health departments like that, what separates the way the doctor treats you like that. And we were always a fan of, maybe it's not a finger-shaking moment for those doctors who treated my uncle a different way at the time. Maybe it's for me to go into medicine. And so that was my first experience with HIV, and caring for or crying for people living with HIV, and my first heartbreak for people living with HIV. And we've seen it over and over again. Now it's 2022. A lot of the times we still see people who don't want to share the same place, people who are the otherness. We still see the otherness. And so that kind of retouched for me in careers. I've been a teacher, a massage therapist, different things, but your passion always finds you. And it always comes back. And so that's how I got into something I enjoy in my practice, which is caring for people living with HIV and working for people living with HIV.
And what's been the most rewarding part of being able to care for individuals living with HIV?
Taking away the otherness, being a Robin to their Batman. And certainly, I moved into caring for communities. The only way you can care for people living with HIV is to care for communities living with HIV, right? Meaning communities where the prevalence is higher, the prevalence and incidence of HIV. So incidence meaning people are, there are more new diagnoses in that area, right? Prevalence meaning there are more people living with it long term in that area or overall. So the only way you can do that is move into communities and work for those communities. And something I just love is just giving a service that humans deserve, and treating people, because people living with HIV are people. Absolutely. Living with HIV. So they're living with diabetes, high blood pressure, the stress of COVID. They're living with all these things that everybody is living with. But sometimes that otherness whether it's in the hospital, whether it's in the workplace, whether it's just in the community, in your worship places. That otherness sometimes takes a forefront, and part of what I love is pushing that otherness back and moving it out of their reality.
So how do we create a system, I guess, where we don't have this otherness, or how do we get, I guess, individuals to be more accepting of people living with HIV?
Mm-hmm. I say it all the time, and I'm sure we'll get into it. HIV, we have medicines now, right? I remember when there weren't medicines for treatments for people living with HIV, right? And then it was just like, to a lot of people, this big scary thing. And then there were medicines that made people really sick, and that was this big scary thing. Now we have medicines, and you have to take them 6 times a day in the past, and all this other stuff. Now we have medicines that, not only medicines that you can take 1 pill every day, but now we have medicines that you can take an injection every month, every other month, that kind of thing. The thing is, I'm talking as a healthcare provider. I am a physician by trade, so I'll include myself in it. The medicines have been updated, but we haven't updated our language, the way we're talking to patients, the things we're saying in the community. So when that happens, there's this huge gap of what actually the science shows and what's going on in communities.
So in updating that data, is that something that we as clinicians could do, or who are we tasked with, I guess, updating that language?
I think it's up to everybody. First, it starts with the clinician, because a lot of people, first, in my community, and I count myself as an African American, and a lot of African American communities, historically, there's been trouble finding a healthcare provider you trust, historically. I'm glad to see there's more physicians of color, advanced practitioners of color. I'm glad to see that. And as people come and say, hey, you read the research, what does it show? You studied this, what does it show? That's there, but remember, that's only like 20 minutes, 40 minutes out of the day. They're 23 hours and 45 minutes that person is living. They're not in the office with me. So it has to be talked about at our tables. It has to be lived in our lives, in our schools, worship centers, everywhere we as a community frequent. It has to be part of the conversation.
So how do we, in thinking about like the Black community, African American community, a lot of times we don't like talking about our diagnoses, whether it be HIV or something as simple as like high blood pressure or cancers. How do we normalize those things and start to have those conversations where we're open and honest about it, so that we can now start talking about them in those circles you mentioned, like church and places outside of the doctor's office?
Well, one of the things I found is when African Americans, no matter how far, I've been in different communities where they're like, hey, we're a tribe, we're connected to our African roots. I've been in communities where they're like, hey, I'm not African, I don't associate with that, and things like that. No matter where we call ourselves and want to be, we still move in tribes. And often in the tribe, you can try to find a tribe leader. That doesn't always look like me. It can look like you're a worship leader. It can look like, a lot of times, the matriarch or the woman in the family. It can look like the male of the family. It looks like the person that's non-binary in the family. And you see in groups, there'll always be a couple of leaders, right? Those are the people that we have to get this information to, so that they can get the information. I remember one of the things, so HIV, we can hop back to that, but for instance, I remember when COVID came out, and you know what I saw across the city of Chicago? When the vaccine came out, when testing came out, a lot of times we vaccinated essential people, but one of the smartest things we did was vaccinate those worship leaders. Because if you look at the time between injections and things like that, they got a chance to get the first dose, get the second dose, and then come back and say, hey, I got it. And that was impactful in getting communities to community buy-in. Because if you don't get that buy-in, we're not getting anywhere.
Absolutely. So you feel like there was a sense of trust. Because my worship leader did it, now I feel comfortable doing it.
Absolutely. Because remember, that worship leader has stakeholder, what we call in my community, receipts. Right? That means they're not new to this. When they talking about,
they
hey,
true to this.
they not new to this. Exactly. They not new to this. They true to this, right? And so that worship leader has demonstrated investment in the community, to the community, but also in the face of misinformation, no matter where it comes from, we know that worship leader or teacher or whoever it is going to stand for what's right in that community.
So how do we, I guess, just to piggyback off that, just in regards to that worship leader or tribal leader, tribe leader, How do we push the envelope in regards to vaccination in the Black community? Because we're still lagging far behind our white counterparts, our Latinx counterparts. Do you think there's still a need to have those conversations where the worship leaders are reaching out, or what's your thought on that?
Wow, my lessons learned while I worked for people living with HIV. Here it comes, it plays out again. So Phil Wilson is a community activist and advocate for community that started the Black AIDS Institute. It said, if Black people are not explicitly included in the conversation, they're going to be implicitly excluded in the conversation. That means if we're not purposeful and intentional about Black health, Black wealth, because that's a thing we don't talk about, right? Because true healthcare involves the transfer of wealth. If we're not very explicit and intentional about that, time and time again, our community is left off the table.
Absolutely, I think that's huge, and that's one of the reasons why we're having these table talks, and really to segue into the state of Black health. A report that came out on Juneteenth of 2020. Yeah. And where things stand in our communities in regards to chronic conditions. And I know a lot of individuals talk about how the COVID pandemic amplified these issues, but this is something that we both know decades and decades this has been going on. It's pervasive in our community. Yeah.
I remember when COVID first hit, and there were all the tents, and there were a lot of tents by different entities, private institutions being built on the north side. And I said, "Ooh, I'm gonna build a tent on the south side." And people came, but I remember one news group came and said, "Why are you building on the south side, right? Is there some information? Because the algorithm says you have to travel, and the algorithm says this." And then I said, "Well, I don't really need that, right? We have history, And they're like, "Well, what are you gonna do to empower and educate and stuff like that?" I'm like, "Well, my community is very smart, and they've been educated by history, so I don't need." And historically, what happens is there is a lessons learned from working for people, communities living with HIV. Remember when HIV was a heavy thing in Chicago on the north side and among populations that identified as white. There was a lot of focus, and then we found out all along and this is not also Chicago, we found this all over the nation, so this is not specific to Chicago, but then we find out African Americans are dying all this time of HIV. So when COVID hit, I didn't need to wait for that gap. I opened up the tent on the south side immediately, right? And I remember newscasters said, "Why do you do that?" I said, "Well, I'm educated by history. I don't know what, And so we have to do that. And the state of Black health took a excellent kind of look at that. And the things I'm saying about HIV, I usually say, I usually draw my little hand thing, and I say, you can say HIV, Hep C. I always say Hep C because now there's a cure for Hep C. If you're living with Hep C or you don't know, get tested because there's a cure. High blood pressure, the things that they said people with COVID were dying of, diabetes, asthma. We can say these are little branches on the tree or leaves on the tree, and we can cut one off, that's Hep C. What happens? That tree grows another branch because the root is inequity and social determinants of health. And when I opened up that report and I saw that tree, I said yes, because that is what we have to address as true facilitators of health in our community.
So how do we get, down to the root cause issue, I think, in regards to these health issues? I know you talked a lot about, setting up those tents and basically not repeating history. And so how do we get to the root cause?
So how much do I say? How much do I say, Dr. Taylor? I'm at the table. I want to, the table is making me nervous. How much do I say, right? So, okay, well, there is I call it the psychopathology the way we think about care in America, right? What happens is, just like COVID, HIV, all these other things, we focus on one group of people, and then we're so shocked. I remember when those stats came out, we were so shocked that Black people across the nation, Latinx people across the nation were dying of COVID, right? And the psychopathology, what I call it in America, is that we get shocked, and we spend this time researching the shock, and we never move from that shock. It's almost like catatonic to us. And we never move. We pay different entities. We pay non-Black people to study Black problems, and we do it. We dish out all this money to substantiate our shock, and we never move from equity talk to to action. And I think that's what you're getting at. One of the great things that I'm sure you know from the city of Chicago is public health wise racism has already been declared. And that was a hard move because imagine I don't work, but imagine the pushback you'll get from something like that because people don't want you to talk about it. I thought it was a beautiful thing because that's going to be like, okay.
Say it one more time for people in the back. Racism is a public health issue.
Racism is a public health issue. And when I saw that be declared by the city of Chicago and by CDPH, I was like, okay, now we're making the mark instead of studying it. Now we want to know the numbers. The numbers are important because when we start focusing revenue and focusing what we're doing in our efforts, our energy, our finances, things like that, we got to know where to go. So not to say numbers are important, but if you look all across the nation, a lot of other places are busy gathering numbers and gathering more numbers. And how many times are we going to study PrEP and the lack of PrEP in our Black population, women and men, and gender non-conforming? How many times are we going to start to study it before we actually do something about it? So I think that was a step in the right direction to say, hey, all the numbers are great. This is a problem. And then break it up and develop a task force to say, hey, here is what we need to do. Now, one of the things that I feel that is needed, in many areas like this, Chicago, Philly, things like that, is back to what Phil Wilson said. If Blacks aren't explicitly included, if we don't get intentional about focusing on the health and wellness of our Black population, then they're going to be implicitly left out. The efforts get diluted and things like that. So one of the things that I'm collaborating with community organizers and things like that, and I'm sure I think you've heard of it, is we're looking at a group of people to consistently say, we're about the business of Black health and not only Black health, Black wellness. Because I think when we start talking about health, people think about me in the room prescribing medicine. But it's actually all those social determinants of health that I think, was it Healthy Chicago 2025 that said housing, food access, environment, public safety, neighborhood planning, all those things impact this quality, not only the quality of life, but the life expectancy.
Absolutely. And so when we talk about those social determinants of health, it's not just, like you mentioned, not just talking about those issues within, not what are the next steps as far as achieving that. This whole thing of thinking about economic empowerment. How do we achieve that? How do we level that playing ground? I know there's always this cartoon that shows how we look at equality. There's like kids playing baseball, and there's equality, equity. But like, we need justice.
Whoa, you're saying the things that need to be said, Dr. Taylor. Okay, so who was it? The attorney, Brian Stevenson, that started the group that was looking at people that were incarcerated, and he's a lawyer, an attorney, and really focuses on working for people that were incarcerated that at the time didn't have the resources for legal representation. And one of the things that attorney or Esquire Brian Stevenson said was, the opposite of poverty is not wealth. So that, and it makes you lean forward, because we have different groups talking about poverty isn't an issue, is somebody's perceived quality of life that's an issue. No, poverty is a strategic form of oppression.
Absolutely.
So they said Brian Stevenson said the opposite of poverty is not wealth. The opposite of poverty is justice.
I love that. There was actually a documentary on Netflix, I believe. It's called Chicago at the Crossroads. And it talks about a lot of this, like the redlining that went on in Chicago, and how we're so very segregated, and how many of these issues were put in place in regards to like poverty and, basically the households that we're living in, and not having access to things like food. So this whole food apartheid issue, this is like there's a long history of that.
You ain't say food apartheid. Let me fix my head. You gonna knock my little head right. Food apartheid.
So I mean, we can talk about that. How there's this whole disparity when we look at, like, all Marianos are not created equal.
They're not.
If we go to 39th Street, the vegetables are not. Sometimes they're expired. Versus like if you go out to Frankfurt or you go to Park Street, it's totally different. And so how do we start to demand those things in our community?
There has to be a group that's focused on it. And and not to say that I mean, I use Brian Stevenson as an example. Not to say that everybody has all the time to focus all their, working time on it and the resources to do so, but maybe a collaboration of, like a group of people to come together and say, hey, here, you take this piece, here's a piece we're focusing on, but also not do it in silos, because we have a lot of people doing it, but I think it's in silos, and we need to come together.
I completely agree. As a Black community, I think it is time that we take that call to action, and that we collaborate and we bring all those strengths to the table. If they don't invite us to the table, we have to build the table or bring the table.
Yeah.
So how do we do that?
Yeah, because who can make a table for us? You haven't been at a table eating somebody else's food. So who can make a table for us? Sometimes we got to create our own tables.
I completely agree.
I've never seen, in this country, in this world, I've never seen a historically oppressed group come out of that oppression by the hand of another group. I've never seen it. The solutions for healing for our community come from within the community, and they might look like a doctor sitting on here with a hair wrap and some hoops. They might look like, a doctor sitting up here with this, like that, and this little almost in the eye, and for our community, that's what's needed.
No, so true.
So there has to be, and there's somebody for everybody, but the healers have to come from within the community and be of the community and be unapologetic about it.
Absolutely, because I know a lot of times there's this whole focus on like Black versus brown, and I don't want to take anything away from our Latinx sisters and brothers, but now is the time for us to come together as Black people and put forth the effort and the work to make sure that we can get some things moving in our community.
Yeah, and I think one of the things that our Latinx peers and our Latinx fellow humans have done is work on some of that galvanization, and it's a beautiful thing. And it's a beautiful thing. I think we're in agreement on that.
Oh, so true.
It's a beautiful thing. And, love it when we have groups focusing on health and wellness for our Latinx Chicago residents, because it's so needed. It's so needed, right?
Vastly impacted as well,
Yeah.
just like we are.
Yeah, and it's so needed. It's so beautiful. One of the things in some spaces, I'm on some task force in the city, and one of the things I always wholeheartedly say is, that's beautiful. That's, I want to move to spaces where it's okay to focus on the wellness of our Black community,
I think we need to just give ourselves permission to do that. I don't think we need to ask anybody for that permission. I think we just need to just do it.
We can. Yeah. And I think for history's like example, it doesn't happen without us. We know what heals us, and our community heals in ways other than, I say this as a physician, our community heals in ways other than going to the doctor. And yes, the doctor, and sometimes for my community, the doctor needs to come to you. I can't just sit up and, build my clinic and say, okay, I'm here,
The doctor needs a doctor.
And sometimes the doctor needs the doctor, because
Absolutely.
the support in that space, the support in that space is overwhelmingly, I find, needed, And so when you say that, there's one of the things that I also have found, going into the healing spaces that our community has, meaning not only am I in the clinic, I'm at the Bud Billiken Parade.
Absolutely.
I'm at the, worship on Sunday, and not just on Easter or when I'm, trying to push.
It's at the CME Christian.
Yeah.
Christmas, Mother Day, and Easter.
I'm there. And it's not a factor of whether I, my beliefs or religion isn't aligned with the community. It's more of fellowship, which is the difference a lot of times that people say between religion and spiritual, but we ain't gonna get into that. But we're gonna talk about the presence, because then, remember that buy-in we talked about, like a lot of worship leaders have? Then that buy-in is both ways. I understand there are nuances to healthcare. We can't have a conversation about vaccine readiness, when the vaccine comes out. The conversations happen along the way at the school pickup, at the PTA meetings. Those conversations are up and down, sinusoidal, as we call it in medicine, and they happen in other places, just like we know at work. The decisions sometimes aren't always made in a meeting.
And it has to be an ongoing conversation.
Yeah.
It can't be just a one and done or this whole megaphone approach.
Right.
Like we need to have those one-to-one, like grassroots reach out.
Yeah.
And so also I think about a lot of times, like in the Black community, how a lot of times our focus is around the table. You think about if you're in a Black person's home, we all end up in the kitchen. We gravitate toward the table. And so really, I think starting to have some more of these conversations, I think are going to be key. And so we can't just stop now. And I think also going beyond this whole pandemic.
Yeah.
So how can we start to, I guess, shift that focus in regards to addressing a lot of the underlying conditions that are affecting the Black community?
I think you mentioned it a couple of minutes ago. We talked about diabetes, we talked about high blood pressure, other things like that, and how COVID came, and when it came, it ravaged our community. Well, the underlying sources of why somebody would do well or not well was the presence of diabetes, hypertension, asthma. I saw this on one in the city of Chicago. Access to food was actually one of the predictors of how well somebody would do if they got COVID, you know? And so those things are on that tree and were prior to COVID. They're going to be after COVID and things like that. And so I think it's smart not to, say, and to say we have to address these root causes. We have to address these factors because, number one, deaths related to diabetes, 70%, I believe, up in African Americans. So they were bad by themselves. Absolutely. And then we added something onto it that made it worse. So without addressing that, and just because COVID goes up and down doesn't mean, okay, you got diabetes, we're going to not worry about that. Because what if something else comes? Absolutely. And even if nothing comes, the right, I always talk about, and you can stop me if I always talk about 1776 syndrome. It's
you took the words out of my mouth. That's what this post-slavery syndrome and the cortisol effect.
Yes. So no, 1776 syndrome. Okay, tell me about that.
So really, there's this thought that the fact that we suffer from more chronic conditions. There's some thought of like there's a post-slavery syndrome where our levels of cortisol are higher. That basically leads to us to be more predisposed to things like high blood pressure and diabetes. And so also currently, like living while Black, you think about just when you go out, into the streets, it's like, okay, am I going to make it back home safely? Or you're looking over your shoulder, or like even thinking about like as far as like you mentioned like safe neighborhoods. And so that's an issue. We're saying we want people to go out and get active, but our neighborhoods aren't safe. Or the thought is that we're going to put more police in places like Lincoln Park. But what are we going to do for the folk on the South Side?
You know what? You must have been in my room, and because I did my residency in Miami. And sometimes going away for 3 years, I kind of got disjointed. I came back and I was seeing a person and they had high blood pressure, cholesterol, diabetes. And
That's
I said,
a triple threat.
Yeah. I said, that's the importance of staying in the community. Let me show you. Gone for 3 years, come back. And out of my mouth from the south side of Chicago, from 95th Street, I said, you don't need a gym, which we don't have a lot of in our community. Exactly. I said, you don't need a gym. You can just go out and run. Check me really quick, and this is the importance. If you're a patient, this is how important it is to level set with your doctor, and don't be afraid to level set your doctor again. Right? I was gone. I charged it to the game. I was gone 3 years. I said you can just go outside and run. You don't need a gym membership or anything like that. He said, Dr. Green, I'm a Black man. If I go outside and start running,
absolutely,
something's gonna happen to me. And I said, is that true? Yeah. And he was like, yeah, that's true. And it reset me to my experiences here before those 3 years I had left, And I'm thankful for that. And you need providers humble enough to say, well, thank you for resetting me. That is absolutely true, right? But then moving forward, how do we then create an environment where people can go running? Which is why I'm glad that Healthy Chicago 2025 put that the environment, that 23 hours and 45 minutes that person is not sitting up in my room, waiting for me to prescribe some medicine. How do we create an environment where they don't need that medicine, where diabetes is staved off? Because I've, time and time again when I'm finding in our community, just talking about diabetes, because, yes, I do enjoy caring for people living with HIV. It's one of my passions. I work for communities where the prevalence of HIV is high, and that is also for the communities with diabetes, high blood pressure, things like that. And some of this stuff is not congenital, right? So it's the environmental factors that's happening. So how do we create that? that space. And one thing I'm saying specifically with diabetes is people think diabetes is high sugar. They're like, I just got high sugar. And being able to be in a space to have that conversation, that diabetes is your body's inability to balance sugar. Absolutely. So what does that mean? And it's progressive. So you are diagnosed with diabetes, you take the medicine, you exercise, or whatever you're going to do. Some people choose to exercise and go into a nutrition plan, and I've seen that work, you know. But wherever you are, those numbers come into balance, and people say, oh, I don't have diabetes anymore. No, diabetes is progressive. That means every day. Y'all remember that strongman thing where they tie this rope to this like car, and the car be going in a direction, and the man got to pull it back? Well, that's the process. If you let go of that rope, that's the thing with diabetes. If you let go of that rope, it's going down the, it's going down the track it's going. So the exercise, the nutrition, stuff like that are part of your strong man or woman or non-binary person pulling that back and holding it in place.
And I think some of it also comes to like the whole education piece too, just in regards to like nutrition. I think, some of this, we should probably start addressing as early as, like second, third grade. I think really talking to individuals about like some of the risks that, we have just by purely being Black, putting us at high risk for things like high blood pressure, diabetes, high cholesterol, and how our diet, like you mentioned, are key in regards to keeping those numbers down. I think, really starting to maybe have like maybe some classes where we pop up and like, okay, well, let's cook a meal. Let's do a 15-minute meal prep or something. And, and I eat heroes, everything in moderation. But I think that, it's so important that we start to, again, have that talk about healthier things in our neighborhoods. I think that's going to be huge.
Here, you're right, because heroes is not an everyday meal.
Exactly.
It is something you enjoy. I eat heroes too, It's something.
Wait,
you Southside.
Southside.
You sound okay Southside. Because when you from the West Side, people be talking about Uncle Remus, which is good too. Don't talk about Uncle Remus. You don't know they like that.
But they say you have to go to the West Side to get the Uncle Remus, not the one on 47.
Okay. Well, I gotta check it out. I gotta check it out. But going back to that, when you enjoy stuff every day, when you enjoy the things you eat, there are people that can help that are from the community. I know people that actually design healthy meals that people actually enjoy. It's not about eating meals, because when we talk about, and this will take me back to 1776 syndrome, what it means to me. When you're having to cook food that you don't find tasteful, that aren't part of the seasonings in your house because you've been diagnosed with diabetes, that leads to other stuff, because nobody talks about how depressing it is never be like, quote, never be able to enjoy some of the stuff. Well, we have people that say, hey, use lemon instead of something, use this instead of this, and cooking foods that are cultural to us. Absolutely. And being explicitly okay with it, right? So 1776 syndrome. In 1776, there was a declaration that people have a right to life, liberty, and the pursuit of happiness, right? I made this up. This is not, 1776 syndrome when we see it play out, even now. So in that room, imagine the faces that are in that room. Imagine the genders, the social class, the spiritual movement, just one gender, one race, one social class, one state, one religion, one stated orientation, one gender identity. Right? We always say, oh, that was then and things like that, right? If it was then, we still have the same. It hasn't been taken out of it, so we still it still plays a part in our everyday life, to the fact that even in this country, except for 2 times every 4 years, we get together as a nation. So I'm not blaming it on anybody, I'm including myself. Absolutely. And we vote in that same gender, that same class, that same orientation. Like, we vote in the same, except for 2 times over the last couple of centuries, right?
Very true.
Not only that, when a lot of times, one of the things that I love about kind of our city is we don't have that same space, but when you look at who is over most cities, most school board rooms, most hospitals,
1776,
right? Most tech firms, right? Most of everything, most automobile. We when it's time to look at who should lead us, we collectively make that same decision. So it's one thing to look and be like, oh, look what they did in 1776. But it's one thing when I can go to the drugstore and the heads of corporate of that drugstore, 1776 syndrome. Imagine how that impacts us today, right? So when I want to eat something healthy, and I'll say I was diagnosed with prediabetes.
Okay.
So when it was time for me to find something healthy, I don't want to go to the nutritionist and experience 1776. I don't want to eat food that's acceptable to one group. I need food that's acceptable to my group. But I said all that to say there are plenty of people doing it in our community, but they're doing it in silos. And that takes us back to that call to action, to galvanize. Let's share these stories. One of the things that breaks my heart for my community in Chicago is we are people that learn together. And someone, somehow, somewhere along the lines, we got convinced to be individualistic. I'm not going to share my stuff with you, my recipe, my this with you, and I'm not going to share what's helping me grow because I need that for myself. And we don't realize that a lot of stuff from African Americans in this country is taken and used by other cultures to grow. So we can keep giving to each other and be open to receiving it back, and we will never run out of progress.
I completely agree with that. I think it's so true.
Mm-hmm. Yep.
So I think you need to patent at 1776.
It's coming off, y'all. Okay, now what you say?
I think you need to patent
that 1776. Okay.
You can write that up.
I'll look it up.
I like that. I like that. I think it's very true though. And so I guess how do we move forward from there with this collaboration? Like I guess we need to talk about like how are we going to activate in the city of Chicago? Yes.
So I think right off the bat, I mentioned the city of Chicago, and we have leaders that are excellent and don't follow that course, right? Part of the problem is a lot of times that it's not only us. People think that if you don't look like, act like, if I say I'm a doctor and I show up with this on, if I say I'm a doctor and I show up speaking like I'm speaking without changing my voice, or if I'm talking in this, this is my voice, it's low like this. They think I have to raise it in order to sound, and that's think about it, that's people's definition of professional.
Absolutely.
1776, your idea of professional, I should show up in a blue suit.
Exactly. You know, talk about the Crown Act, I'm here with my curly fro hawk.
Come on, Crown Act. Come on, Crown Act. Come on. And so getting away from that, I love that the city of Chicago is moving in that direction. I love what our Latinx brothers and sisters have done. And I do think we should, again, galvanize. Next steps would be kind of getting groups, start to meet, have a framework, and grow out from there. And be intentional about it. Be unapologetic about it. And then be willing to do this, right? I identify as an African American. I don't know how you identify.
I'm a black woman. I have actually done my ancestry. Oh. So
awesome.
Crying, but I've done my ancestry. Yes. So I'm African American.
Yes. And so sometimes even amongst us, a lot of times I say, if we say we want to focus on black people, some of us get uncomfortable. And historically so, because, a lot of times we have a lot of examples of when people of African descent, black African Americans, however we call ourselves, get together, there's been, push and pressure and trauma from other cultures. But that doesn't mean we have to get uncomfortable with it, right?
Let's get comfortable.
Let's get very comfortable.
COVID has taught us that, like how to be adaptable.
Yes.
How to work together. And so I think there's going to definitely be power in numbers.
Yep. I think I know there'll definitely be power in numbers. And also one of the things that I think I struggle with growing up, and not a lot of people say this, because we're built in this 1776 syndrome, the further away you get from that, you're not that gender. You don't identify as that gender or a gender. You don't identify as that, culture or ethnicity and things like that. You didn't grow up with wealth, enough wealth to just be in a room at 20-something signing a declaration of,
Exactly.
You didn't grow up with that privilege. You talk about being at the table. Whoa, you know what I'm saying? There was And so you don't come up from a family where literally now the definition of the signature is John Hancock. We literally still call it that. Absolutely. So you don't come from that. Sometimes you wonder if you can do it, but then you have to remind yourself, our community has been doing it for other communities since the inception of the country.
Over and over.
Yeah, and don't let me get into our indigenous Americans that have been doing so much work for other people since the beginning of this country, and so having that faith in ourselves is going to be what's needed moving forward and for future, because one of the things I've seen a lot of times is we'll grow it out. We'll get some trauma and things like that. We'll get pressure from other communities or outside, or sometimes from within, to let it go, and then it just dissolves. We have to continue. It's a relay race. Absolutely. This is a relay race. You hand it to the next person, and hand it to the next person, and you run together. And
pressure builds diamonds, so.
Diamonds.
Some diamonds in the rough.
Hey, yes.
Go back. We may have to come on. We don't have to do a part 2 to this. We can do a little history of how we met.
Yes, let's do that.
Go way back.
Go way back. Yes.
So I want to just touch a little bit on this, the life expectancy in the city of Chicago, and really how our Black community has been impacted. And so when we look at the life expectancy of Black people, we are lagging 10 years behind our white counterparts. And less than 70 for the first time in decades. We're at 69.8.
Yes. And how that plays out, like I remember right before that, I think it was 8.8, and then it became 8.8 years. I'm sorry, the gap was 8.8 years. Now it's 10. The difference we saw was COVID, right?
Absolutely.
One of the things we learned is, and talk about building infrastructure, and I know we got more stuff to talk about. When you look at it, which is why I love the CDC, that they changed the booster age to 50.
Yeah.
Because I remember when the first dose, we were making it eligible for people 65, right? And the life expectancy in some of our neighborhoods is 60. So I was like, what are we doing here?
Exactly.
So I love that, we learned from it. My hope is that we learn quicker, because we have a lot of history that tells us if I know that life expectancy of somebody in Inglewood is 60 years old, then I can't make the cutoff 65. What am I doing? What am I doing?
Absolutely.
Yep. So yes, sorry.
And so really one of the key drivers behind that is this whole issue of like cardiovascular disease. So things that are definitely preventable. And so how do we start to, I guess, also push the envelope in regards to improving our outcomes. And so a lot of these things are very preventable. Other things that gun violence, homicide due to gun violence, opioid overdose. And so I'm actually going to have Dr. Jasmine on the show here in a few weeks, and she is medical director here at CDPH, and she does a lot of work around behavioral health, but she is like the Narcan queen, making sure that everyone has these test strips. And so really I think we just have to start having these conversations, letting people know that we have some resources here at CDPH and beyond.
Yeah, I love that, and I actually also love kind of what we're doing, talking about nutrition. One of the things that recently broke my heart is the decrease of healthy food sources on the south side of Chicago, right? Yes. Now we can talk about the decrease on the south side of Chicago. On top of that, the initial lack on the west side of Chicago. Period. Absolutely. And so Chicago being one of the most segregated cities in the U.S., you can remember we said poverty is a strategic form of oppression. So you can literally just not put a pharmacy anywhere on the west side, even though the rates of diabetes, the rates of things that where medication does help, you can literally just coagulate all the health, the exercise facilities, gyms and stuff like that on the north and downtown sides, and just say, and look at the lack, right? So when you look at diabetes, hypertension, hyperlipidemia, those type of things, healthy activity plays a role. So one of the things we can do is just put more of that, create more of that access in those communities.
And then I think also we have to take into account like the whole economic empowerment piece. I can think about timeless times when I was working as a doc in the office, where patients would come in, and we always talk about this whole quote unquote non-compliant, which I hate to hear, especially when we're addressing African American patients. But the thought is that, oh well, this person didn't get their prescription filled. But so we have to address the underlying issue. The social ills. Was there an issue where I had to choose between feeding my family or getting to work versus getting those test strips? And so we really have to like level this playing ground in regards to economic empowerment.
And the quality of life that person experiences. Like, if you have to choose between, we talk about diabetes, progressive disease, you gotta do all this, and now I gotta choose between feeding my family and getting this medication. That is, imagine the internal trauma that person is feeling. You know, I remember, love my mom. So a lot of this stuff, I think we all just try to work out stuff that happened that we experienced. I remember my mom, who's now a non-smoker, been for over a decade. You know, go mom. You know,
mom.
Yeah. I remember when we were younger, and I remember sitting at the doctor's office. It was her appointment, and the doctor said, "Stop smoking. You gotta stop smoking." Blah 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 blah. He never addressed the stress of taking care of us, the family, the home, and the communities that he never addressed that. And the fact that at that point in her life, it was helpful to her. It made her feel better to smoke the cigarette. He was just like, you gotta stop smoking. Okay, I've done my counseling, check that box. You know, not like, why are you doing that, and addressing kind of one of those things. We also see more movement towards addressing the background factors. And who is it? Dr. Keith Green, Jerome Montgomery are working on the Chicago Methamphetamine Task Force, you know, addressing the factors surrounding it, not like, just get off meth, get back to your life. You know what I'm saying?
And those, you know, that when thinking about being in the doctor's office, that whole 15-minute visit, that's not enough time to address these issues. It's just like, you know, we're not just, I mean, we're treating families. We're not just treating that one individual. We're treating also like a long history of like structural racism. And so really trying to at least just getting that bond with individuals. And so I think it's just so key, like you mentioned earlier about the whole representation. Like right now, African American physicians make up less than 5% of U.S. doctors. And so I think starting to go back and, you know, talking to kids about how they can become a physician. I think it's so key in order for us to increase that workforce.
Yeah, you know,
they say that patients taken care of by Black physicians, Black patients taken care of by Black physicians have better outcomes. And white patients taken care of by Black physicians also have better outcomes.
Hey, but you know, that's nothing new. We've been taking care of people since,
long time. 1776, 16.
But also, if you look at, you mentioned the structural framework in this country, right? And so 1776 syndrome, we were all born in, like those of us that were born in this country, you're born into a system, right? And a lot of times I like to say, well, I didn't do it, Dr. Taylor, to you, so it's not my problem, you know? But we don't recognize, if I can, so I came from the south side of Chicago, yes, you know, I remember when I went to undergrad, my mom she was a teacher. She went and pulled out of her, you know, the monies to pay for my first semester tuition so that I can get better grades, so that I can get a scholarship. You know, that is a form of privilege. And so we don't realize that a lot of people that sit at different tables, you know, talking about other people's bootstraps, never had to employ that bootstrap measure. We want people to pull themselves up with bootstraps we never had to use. You know,
have to reach back.
And so we have to, but in order to do that, we have to go. So because the systems is built like that over these centuries, 1776 is built into infant mortality rates. You look at the infant mortality rates. It was in the state, you know, was it in the state of Black Health Chicago? Was it in Healthy Chicago 2025?
Both.
Look at the infant mortality rates being 3 times, you know, everybody else in the African American community, from birth to diabetes-related deaths, from birth to death, in the nuances, in the kindergarten room, in the food nutrition place, in the grocery store, in all these areas, that support is embedded. And it's that way because all of us wake up every day into whatever forms, I'll just call us a whole nation, and we embed that privilege every day. The only way that we're going to get anywhere is we have to start getting up every morning and infusing equity into every facet of our community's life.
I love that.
We all have to do our part. We got here, let's be honest, we got here because we all did our part.
We did.
You know?
Yes,
okay?
we did.
The only way we're going to undo this is if we all do our part.
So we're calling on you to come out and do your part.
That's right.
Not just our Black physicians here in Chicago. We're calling on our legislators.
Yep.
We're calling on our attorneys. We need some help. We have to do this for us.
Yep. and we have to do it for us and be unapologetic about it.
Absolutely.
Mm-hmm. Yeah.
It's a song. They sing it at my church.
What?
Unapologetic.
Oh, they
black.
do? Hey!
Yes, they do. All right, so we want to talk a little bit about like some action steps, and you mentioned this infusion of equity on a daily basis.
Mm-hmm.
And then we had our call to action in regards to like reaching out to some of our Black colleagues here in the city of Chicago. And so really, I think that it's time that we take up the shield and move forward in regards to the state of Black health.
Yeah.
I don't want to see numbers like this again, as far as like in my community where we are dying at this high rate, like a life expectancy of less than 70 in one of the most industrialized nations.
Mm-hmm.
It just doesn't it baffles me. It's so disheartening.
Yeah. And like you said, so when we talk about our colleagues, I'm a physician, Dr. Taylor is a physician, but we're talking about colleagues, the ones who facilitate community healing, right? That means you can be a teacher. That means you can be the person that's helping our kids. I love those people that are helping our kids get to school with a little stop sign. I love it. That means from whatever attorneys, that means from whatever form that you are, at the daycare, whatever, because remember, we need equity in all those nuances.
Absolutely.
You are the colleague, because we started this by saying we facilitate community healing. And that comes in many forms.
It's holistic.
It's holistic. Mm-hmm. And so being able to come together and galvanize, because there's perspectives, that's like saying when we talk about health, Black people or a patient is just this one thing for those 15 minutes. And we are all multifaceted. We have so many nooks and crooks and great spaces and spaces we're working on in our lives. And that's where the equity needs to be infused.
No, so true. I mean, thinking about like our mental health professionals, we need to have a call to action for that.
Mm-hmm.
Our gym owners,
yep.
People that are providing us with transportation.
Yep.
I think it just needs to be, like you said, like a entire community just banding together in the Black community and coming together to work on this health issue.
Yep, I'm ready to do it, and I'm going to reach out to you because you at the CDPH. I'm going to reach out to you. And also I do want to say, as a person seeing you, I remember doing a community. This is maybe 3-4 years ago, or maybe 5 years ago. And then another time 8 years ago, having contact with you through not only us sitting here talking medicine, but seeing you in the community. I'm over here volunteering for this thing, and who pops up? Dr. Taylor, I'm over here advocating. I'm like, I'm going to go down there and I'm going to advocate for this hospital or whatever. Who do I run into? So also being ready to not just do it. I mean, I love this IG Live. I love that you're approachable and stuff like that. So, and it's needed, right?
No, so true.
But outside of this IG Live, also being in the community, what we call being about that life, and it has to be like that. We have to wake up every day. We have to do what you're doing. Wake up every day and think about how can I make the greatest impact for the people I'm so honored to serve. And I want to say thank you for doing that.
Absolutely. Thank you so much. And I'm honored to have you here on the show because you're doing the same thing. You're walking the walk, you're talking the talk. I mean, the work that you've done around the COVID-19 pandemic. So I'm going to tell a little story. So I'm an OBGYN.
This is so weird.
I'm an OBGYN by trade. And so prior to coming to CDPH, I worked in that world. And so I had access to various swabs. So I get a call from my good friend here, I'm about to set up these tents over here in Inglewood. Mm-hmm. I'm about to start testing individuals for COVID. You got any extra swabs over there? And I was just I was scrambling, okay, I'm going to find some swabs for you. But that was just you were just so innovative in that process. Yeah. And I really love the fact that you're we're not going to repeat history here on 63rd. Mm-hmm. Let's fix this.
Right.
And you got ahead of that.
Right.
And I applaud you for that. And as far as the vaccine setup stations, I mean, that was huge, what was being done.
Yep. And I think one of the things, speaking of Inglewood, that we have people Aisha Butler, we have people like Tanika Jenkins that are doing things to infuse things around nutrition. We have people like Fresh Roberson that are doing things to infuse things around nutrition, safe spaces like the Primo Health. One of the things we have to look at next for the neighborhood is what does it mean to feed your body healthy things, and what does it mean to provide with resources that do that, and don't shuck away from it. Don't say, oh, we don't have the money, actually do it. We have to look at what that means to support somebody's increase in their quality of their life, not the 1776 life that we decided they should have, you know. And not only that, the things you do, Dr. Taylor, the things you mentioned I do, I know there are a lot of people out there that are doing it, you know. Again, getting back to the call to action, let's get together and do it together, you know, because none of us without all of us.
Absolutely. So in regards to that, so we're calling, it's a call to action to a Health Equity Alliance called UJMA.
Mm-hmm.
And so a group of us actually came together maybe about a month or two ago, and we started some groundwork in regards to this. And so really want to just pick that up and start to galvanize so we can get this up and running, because we have to do this for us.
Yeah, we do. And I'm excited to continue to do it.
So we'll be reaching out. You can reach out to us. You can email me at Dr. Taylor's Table Talk at thecityofchicago.org to find out more information if you're interested in joining this movement. It's going to be a movement.
It's gonna be and gotta be.
Yes.
Boom.
Yes.
Yep. Is that it for today? All right.
So we will see you back in 2 weeks, and you can check the City of Chicago's website in regards to who our future guests will be. We'll be focusing a lot in regards to mental health, and so definitely tune in. May is actually Mental Health Awareness Month.
Yes.
And so it's just so important that we start to normalize therapy and we destigmatize it in the Black community. Again, thank you so much for tuning in, and we will see you back in 2 weeks.
Thank you.
Thank you.
No problem.